Postpartum pyrexia refers to body temperature of 38 degrees Celsius or more on two or more occasions during the first 10 days of the prepucium, excluding the first day. The risk factors include prolonged labor, prolonged premature rupture of membranes, retained placental tissue, instrumental deliveries, and birth canal injuries. So the main causes are malaria, uterine infection, endomyometritis, perineal infections, for example, infected episiotomy, breast problems, like engorgement, mastitis, abscess formation, and urinary tract infection, respiratory tract infections. The symptoms are fever and other symptoms as related to cause. The main signs that are usually elicited are fever and other signs as related to cause. Investigations, FBC, RDT, blood film for malaria parasites, blood for culture sensitivity, urine for culture sensitivity, high vaginal swab, fasting or random blood glucose, pelvic scan to exclude retained products of conception, or pelvic abscess. The main treatment objective is to identify and treat the underlying cause. Non-pharmacological treatment, examination under anesthesia with possible uterine curettage for retained products of conception. So encourage frequent emptying of breasts as if causes due to engorgement. And also incision and drainage for breast and perianal abscess. With pharmacological treatment, breast problems as engorgement, you give paracetamol around 1 gram 6 to 8 hourly as required. And breast problems, that's mastitis or abscess, you give flucloxacillin around 500 milligrams 6 hourly for 5 to 7 days. Or endomyometritis and perineal infections, you give amoxicillin plus clavulanic acid IV 600 milligrams to 1.2 gram 8 hourly for 72 hours, and then you give metronidazole IV 500 milligrams 8 hourly for 72 hours. Then you give amoxicillin clavulanic acid around 625 milligrams to 1 gram 12 hourly for 7 days, and then you give metronidazole around 400 milligrams 8 hourly for 7 days. The referral criteria: you refer all cases of severe sepsis to the hospital for management. So let's quickly look at the management of postpartum hemorrhage, postpartum pyrexia flowchart. So when the patient presents with fever more than 38 degrees Celsius or more during 2 to 10 days postpartum, you take the history, you include labor and delivery, you examine, you do basic investigations, MPCs, urine RE, FBC, and then you determine the likely cause and severity. For example, shock. Is the infection severe? If no, you start oral broad antibiotics, amoxicillin, clavulanic acid, and metronidazole. And if breast, you give oral flucloxacillin. Then you give analgesic like paracetamol if pain, and you monitor progress and review after 72 hours. Is there clinical improvement? If yes, you continue oral antibiotic treatment for 5 days. If no, you refer. So is this infection severe? If yes, you start IV fluid resuscitation, you start IV antibiotics, amoxicillin, clavulanic acid, and metronidazole. Then you monitor vitals closely, and then you refer. On the referral hospital, you identify and treat the cause. You perform abdominal and pelvic examination to determine if retained products, pelvic abscess, among others, are present. So you do additional investigations like ultrasound, blood culture, urine culture sensitivity, high vaginal swab as necessary. You continue IV resuscitation with IV fluid or blood as necessary, and continue IV broad spectrum antibiotics, and you replace with appropriate antibiotics when culture sensitivity results become available. And also consider surgical intention, for example, evacuation of uterus, incision and drainage, and laparotomy.